I'm Dr. Vikas Gupta. I'm a consultant oncosurgeon or cancer surgeon attached to MGM Hospital, CBD. Today I'll be discussing with you what are called as gastrointestinal cancers. These are very common cancers which affect the entire gastrointestinal tract in individuals. So what do you mean by gastrointestinal tract? Gastrointestinal tract is essentially the entire part of our body through which the food passes when we consume the food through our mouth and finally when we defecate it. It includes, once the food enters, what is called as the esophagus, which is a food pipe which is present connecting the mouth to the stomach, and it is present in our chest area. So once we consume food, the food goes from our mouth and goes below in our chest through the food pipe, and this is what is called as the esophagus. From the esophagus, the food enters into the stomach, which is the place where there is digestion of food happening. From the stomach, then the food goes through small bowel, which is a tube-like structure again, which is present in the abdomen, which forms a major part of our abdomen. The food passes through the entire small bowel, and then it enters into the large bowel, which is again a tubular structure, hollow organ, which is a bigger diameter than the small bowel. The food passes through the ascending colon, the transverse colon, the descending colon, and then the sigmoid colon. Once the food goes through the colon, it then enters into what is called as the rectum, which is again the storage area of the fecal matter, and finally you defecate the feces through the anus. So this is what forms our gastrointestinal tract. When the cancers affect our gastrointestinal tract, they are called as gastrointestinal cancers. Coming to different type of cancers, if the patient has an esophageal cancer, the patient will develop difficulty in swallowing. So if you have consumed food and if you think that the food is getting stuck in your throat area, it's not going down easily, or if the patient develops vomiting or is not able to consume food, then we can say he or she may have developed some kind of gastrointestinal cancer. Sometimes the patient will have dysphagia, or the difficulty in swallowing for foods, sometimes for liquids, and sometimes the patient may not be able to consume anything. This needs further evaluation. For this, what we do is called an upper GI endoscopy. We pass a scope inside, we see the entire food pipe. If we find anything suspicious or a lesion in the food pipe, we take biopsy from it. Once biopsy confirms that it is esophageal cancer, we send it for evaluation. We do further imaging to confirm the stage of cancer. It can be in the form of a CT scan of the chest and abdomen area, which shows the lesion, its extent, and we get an idea about what is the stage of cancer. We may also sometimes require a PET scan to see if the cancer has spread to any other part of the body. Once we have the proper stage of the cancer, we plan the patient for some kind of surgery or some kind of therapy to treat the cancer. Many times we may go ahead straight away with surgery of the patient, in which we remove the entire esophagus, that is the food pipe, or part of the esophagus. Once we remove the part or entire esophagus, we then reconstruct the esophagus, which our stomach is made into form of a tube, and then this tube is brought up inside our chest and anastomosed with the upper part, either in the chest or in your neck area, so that the patient can consume the food through the normal pathway. Many times we may offer the patient some kind of therapy before or after the surgery, like chemotherapy or radiation. Chemoradiation can be given before surgery or after surgery, depending upon what stage the cancer is. Once we have finished the entire course of treatment, that is surgery, chemotherapy, SOS, or radiation therapy if required, then we can say we have treated the patient. These patients need to be followed up regularly afterwards to be sure that the cancer has not come back, and that about the same will be counseled to you by the doctor. We have facilities of doing these surgeries at MGM Hospital CBD, including both open as well as minimally invasive. So if anyone of you has any kind of these symptoms, please consult your doctor and do visit so that you can diagnose it early and treat it early. Thank you.